Hello, I'm Dr. Len Saputo. Welcome to Pioneers in Healthcare. I'm the founder of the Health Medicine Forum and have been in practice in the Diablo Valley for about the last 30 years. This show is about pioneers in healthcare, people who have done something special to bring the profession forward in their own special way and sometimes at great personal risk to their own safety. Today we have a very special guest, Dr. Frank Shallenberger. Frank, it's great to have you here.
It's good to be here, Len.
Thanks for joining us.
Thanks for having me.
A few little things about Frank. First of all, he graduated from the University of Maryland Medical School, and he's board certified in family practice. He's one of only 16 physicians in the state of Nevada to have boards as a physician, a homeopath, and in complementary and alternative medicine. He's a member of the American College for the Advancement of Medicine, the American Prevention Medical Association, the American Association of Anti-Aging Medicine. He's a founding member of the Oxidative Medical Foundation and a board member of the Orthomolecular Health Medicine Society. He was a clinical instructor of family medicine at UC Davis here in Sacramento, and he was appointed by the governor of Nevada to be a state board of homeopathic medical examiner. He's a specialist in anti-aging medicine and board certified in the American Board of Anti-Aging Medicine. He's published scientific papers and he's lectured extensively in the U.S. and abroad, has produced research that's interesting, and he's a former member of the Mount Diablo hospital system, where he was on the Family Practice Committee and Emergency Medicine Committee. So Frank, you have a very distinguished record that I think is a lot different from what you see in most physicians. You know, most doctors are content to go through their medical training, they do an internship and a residency, they go into clinical practice, and then they do what they were taught, and they occasionally read some literature. You're a pioneer, have become very controversial because of the stands that you've taken, and you've done that from the start. And I'm almost embarrassed to say it took me 25 years to figure out that the system had problems before I really got into this area that you're involved with and now we're colleagues in. What was it that tipped you off, that medicine wasn't quite on the mark and more had to be done?
Well, yeah, you know, I have thought about this course, and then I write about it in my first book, Bursting with Energy. But the way it worked for me, Len, is from the earliest days when I was in medical school, I was really interested in trauma. It seemed to me that that's a real appeal to me. It's straightforward. I can see
there's real medicine there, too.
Yeah, I can see what happens. You're broke, I put you together.
Yeah.
It's the kind of thing that appeals to my left brain mechanical mind.
Well, it makes sense, too.
Yeah.
You want somebody like
that.
that.
So I did trauma medicine, and I did it for 6-7 years, and for a bunch of different reasons, I decided not to do that and just to get into regular medicine. So that's the background I came from, and I'll explain why that's significant in a sec here. But then I just got into regular medicine. I hung a shingle out, became a family practice doctor, and you know, I was doing it for about 6 months. And it just really occurred to me that, you know, my patients really weren't getting well. At least they weren't getting well from anything I did.
Yeah.
They either got well on their own, and I just sort of sat around and gave them some pain relief or some sort of symptomatic relief until they got well on their own, or they never got well, and I continued to give them medications for blood pressure or arthritis or whatever it was I was giving them medications.
And that only took you 6 or 7 years to figure out.
No, that took me 6 months to figure out.
6 months? See,
yeah.
well, you...
6-7 years in trauma.
It
and
took
then
me 25 years to figure out that, and I was getting depressed because all my patients were on drugs, and most of them 4 or 5 or 6 or sometimes 8 or 10, and they just weren't getting better. And it would be like regular business. And I lost interest in it, and that's why I shifted. But go on with your story.
Well, I think the trauma set me up for that. Because trauma is real straightforward. You know, if they come into the emergency room with a knife wound, you don't just give them some codeine pills and send them home.
Right.
You know, you want to you know, pull the knife out, see if it lacerated anything, fix it up, and by the time they actually leave the hospital, you've addressed the causes of the issue and fixed it. It's over. It's a done deal. There's no more of it left. You basically cured that patient of that problem.
Right.
That's the way trauma is. Either that or they die.
Right.
So, you know, in my naivete at the time, I thought that's the way medicine was practiced. Patient come in to see you, they had arthritis, or they had hypertension. You found out why they had it. You eliminated the cause. They went home. Everything was happy.
Yeah.
So that's why, you know, within 4 to 6 months, I realized
something's wrong here.
That's just not doing that.
Right.
So I asked all my buddies at the family practice committee there. I said, you know, what's up? I've just been doing this a short time. I'm sure I'm doing something wrong. So, you know.
You were right about that.
They said,
little
no.
did you know we're all doing something wrong.
They said, no, actually you're doing it the right way. I said, but nobody's getting any better. And
Right.
they said, well,
Yeah,
that's
the
you know,
way it
we all
is.
deal with that. I'm sorry. You
Right.
know, that's just, you're going to have to get used to that.
Uh-huh.
And that's when I started to say, you know, there's got to be some answer. I know darn well they didn't teach me everything I need to know in medical school.
Oh,
that
right.
much I've always known.
Right.
And so I thought, you know, maybe this is just one of those areas. So that's what got me rolling.
And so where did it take you? What kind of path did this take you on? I know it's a long journey. That's a huge question, but maybe you can do it sort of.
I'll tell you an interesting story. So at that time, I found out about what was then known as the Orthomolecular Medical Society.
Okay.
Right, with Dr. Kunyan and
Okay, let's define orthomolecular.
Dr. Julian Whitaker, and Linus Pauling was in at that time and
yes,
such.
yes,
Orthomolecular medicine refers to, you know, ortho means to correct.
Mm-hmm.
And molecular means molecules, so it's to correct the balance of the molecules in the body, basically.
Using natural approaches.
Assuming all disease conditions start from an imbalance, molecular imbalance in the system, what do you need to do to correct that balance, and then you can cure the disease.
And of course, that theory is absolutely correct.
I think it bears out. If you work it that way, it
40
bears
years
out.
of medicine, I agree that it's that way.
Well, that's Linus Pauling's idea.
Yeah.
So, so that particular medical society was one of the few at the time that were dealing in areas that we can call alternative medicine. So
Isn't that odd that basic premise that really does the healing is called alternative medicine when it's actually what's been done for tens of thousands of years by Mother Nature? Fortunately, we have all the equipment to heal.
Yeah.
The body does the healing. The doctor's standing by, assisting it at best. Hopefully not interfering with it.
Hopefully.
All right, so go on with your story.
So I went to this meeting, and now I'm the neophyte. I don't know what's going on. I'm just a medical doctor that graduated medical school and knows about suturing up people and giving them medicine.
With all these giants.
So I'm in this room with, you know, Linus Pauling and the rest of them, which are basic, you know, they are giants in this field. And I look up and into the audience, and who do I see but the chief of our medical staff?
Oh, no. That's a surprise.
So I see the chief of the medical staff, and I go up to him and I said, John, what are you doing here?
Well, that must have been John Toth.
Yeah, it was John.
Yeah, of course. He's one of us.
What are you doing here?
The better question is, what's he doing there?
You
But
know,
anyway.
And he says, look, you know, I thought I came to learn some more, but do me a favor. And I said, what? He says, don't tell anybody I'm here.
Sounds like John.
But that kind of exemplifies the time. This was about 1978, 1979, and that was the time when, you know, you didn't even want anybody to know that you were thinking about giving somebody a vitamin or thinking about making a lifestyle change.
Yeah.
Because you would have thought the people who called you a quack would have said, you know, you're doing something wrong.
Well, your medical board, worse off,
Or
might
the
have come
medical
after
board
you.
got you, yeah.
Because they were, at that time, really intolerant of anything that's out of the mainstream.
They're pretty intolerant now.
Yeah.
They've expanded.
They're getting better.
They've expanded what they now accept to be true.
Yeah.
You know, but there's all the stuff on the edge.
Yeah.
They're still intolerant of that.
Yeah. Well, fortunately, some legislation has passed,
Yeah.
which allows a little bit of flexibility. And the way it reads is as long as you inform your patient of what the standard practices are, and you don't try to dissuade them from that, and you present the other story, and they decide to do it, it's fine, so long as there's no harm. If there's harm, you're still up for all kinds of problems. But that's where the law is. Now, the question is how much leeway will we have? And that hasn't been tested in court yet, so you don't really know. So
That's right.
Your point's right.
Yeah.
Okay, so
that's how I got into this, and I started off with nutrition at first, and I found out, hey, it works. I had people with chronic headaches that if I was using the conventional medicine model, they'd have just seen me forever and ever for some kind of medication.
For refills.
That literally got cured.
Right.
Became cured. I saw patients with arthritis that literally became cured. I treated a woman once with rheumatoid arthritis that was literally cured on a diet elimination program. And I'm talking cured. I'm using the C word here. I'm not talking just was better and had some symptomatic improvement. The disease went away, and there was no evidence of the disease anymore in these people, either laboratory evidence or physical evidence of disease. And so you only have to do about a few of those cases
and your
where
eyes
you realize,
pop open.
uh-oh, uh-oh, now I've got to go back and relearn everything.
Well,
And that's
really
what
true.
I've been doing all my life. It's what I'm still doing.
Well, and it's been quite a few years, and you don't know it all. I mean, there's so much more to do, and yet you've expanded your horizons in a whole bunch of different fields. It's not just like you're doing nutrition. Although, without nutrition, what can you do? I mean, the terrain of the body, the way the body responds, its defense mechanisms, its way of protecting itself is a huge factor. And if you don't give the raw materials the body needs to be able to manufacture its products to take care of itself, how could you expect it to function? Particularly if you've got a genetic defect or if you've got a toxic exposure that's interfering with that. And that's where this whole idea of nutrition, pollution, stress in the orthomolecular model that you and I know so well has come into practice. Now you've taken this, your studies in some different directions, and you're really geared to do maybe more things than anybody I know in a whole range of areas. You're doing oxidative medicine, for example. Tell us what that is.
Well, that would be my weakness. My weakness is that
Start out with the toughest
I get
one.
too interested in everything. I should specialize. I should specialize in arthritis of the left hand or something, you know, but to make my life simple.
Medicine's not like that.
But I can't. I'm like a kid in the candy shop.
Don't you have to know a whole lot of things to be able to have a balance in what you do and have a whole bunch of different approaches?
It's the way I'm wired.
Yeah,
You know,
so
that's what I do.
So what's oxidative medicine? What does that mean?
I like to break down things in terms of what I call the 4 quadrants of health.
Okay.
So one would be exercise, learning how to exercise. One would be learning how to eat. And one would be learning what things to take. And by that I would mean like vitamin pills, supplements, hormones, whatever, medications would come under that head. Yeah.
Okay.
And the last thing would be learning how to deal with stress. But I call those the 4 quadrants of health. And if you can get those balanced to your genetics, that's the secret. That's what makes you heal, and that's what keeps you well.
How would you get sick if those were balanced? You probably couldn't.
You'd have to try hard.
You'd have to really work hard. Okay.
So oxidative medicine really comes under the heading of exercise. What exercise does is it stimulates the body to use oxygen. And you know, all that oxygen that you take in, it only does one thing, and that's it produces energy, period. That's all it does. And so how well you make that happen is pretty much critical to how well your body is going to be able to heal and take care of itself.
All right. So
and oxidative medicine comes under that. It's ways to make your body handle oxygen better.
Okay.
The premier, most common form of oxidative medicine is aerobic exercise.
Because it makes a lot of free radicals, and it's what gets your body to adapt its own oxidative stress protection system and to allow you to do more things safely, right?
Well, there's this process. You know, this is kind of analogous to a car engine, but there's this process where you take in the oxygen and you burn the fuel, which could be carbohydrate or fat, and from that you produce energy. Okay. Now you can do that efficiently, or you can do that with a low level of efficiency.
Okay.
You want to do it efficiently, because if you do it efficiently, what you get as a result is 1, more energy, and 2, less internal pollution, less free radical activity.
Okay.
So you want
a nice way to say it.
Do it efficiently. If it were your car, to do it efficiently, you take it into the mechanic, you'd say, you know, tune all the little knobs up and get it all running well.
Reset the car.
But in your body, you don't do that. You exercise it. You exercise it, and that's going to make it more efficient. I mean, think about it. You got a guy that's out of shape, and at some point down the line, he's running a marathon. He went from being inefficient to very efficient, and that he did that through progressive exercise and conditioning of the body. So oxidative medicine in its simplest, most everyday form is aerobic exercise. Now, when we use that term oxidative medicine, we're not normally saying that, but that's what we're thinking about. Because when we use the term, we're talking about sick people. So if I have a patient come in that's sick with, say, stage 4 cancer, or he's sick with any kind of debilitating, you know, degenerative disease,
right.
I can't tell him to go run around the block.
No.
I'm not going to put him on a training program.
Can't do it.
But I can give him oxidative therapies. I can give him oxidative medicine, which is sort of like exercise in a bottle. I can administer that to him and increase the efficiency with which he burns oxygen without him having to exercise at all.
Now, you designed a test that's specifically made to do that. It's called a bioenergy test.
That's true.
Tell us about what that test does, because it really is an important way to differentiate who's sick and who's not sometimes. And how sick are they?
Yeah.
How bad is their oxidative metabolism? So what is this test?
It will measure how efficiently you use oxygen. Now, from what I've just said, you could say, hey, that's a pretty good test. Let me have that test. That's
like
a good
to know.
idea.
Where do I fit?
I want to know how efficiently I use oxygen.
How young
Because
am I?
that makes pretty good sense. It's like saying, I want to know how efficiently my car uses gas. It's the same kind of sense.
Mm-hmm.
This is the four fundamental basic of what keeps us healthy, is how well we do that. So I developed a test that measures that. And it's a pretty simple test. Basically, it looks at two things. One is how much oxygen is disappearing into your body. We use a mouthpiece for this. So you can imagine like something like a snorkel, but there's a mouthpiece, and you're breathing all your breath through that mouthpiece.
It's all pure oxygen.
And it's going to measure how well you can, all that oxygen, how much oxygen goes into your body, and how much carbon dioxide comes out of your body.
So why is that important?
Well, by knowing those two variables and then hooking that data up to a computer which runs it through some mathematical variance, I can tell you how efficiently you're using oxygen, because the ratio of carbon dioxide to oxygen under certain conditions of exercise will tell me your efficiency. For example, if I get you up to an efficient, if I'm exercising somebody, say at such and such a level, say I'm working them at 120 watts of exercise. Okay. If their ratio of CO2 to O2, the amount of CO2 produced to oxygen consumed, is low, they're more efficient.
Okay.
The lower that ratio is at that level of exertion, the more efficient their oxidative metabolism is.
All right. So
and we can measure that.
They need less fuel to do the same amount of work.
Exactly. They're getting more bang for their buck out of their oxygen.
All right. So people who have cancer or Lyme disease or chronic fatigue or fibromyalgia or a condition like that where energy production is markedly compromised, this test will tell you how compromised it is and give you ideas of where you sit and what you can do to remedy that situation so you can make energy more efficiently.
It will give you a reliable number that you can use. The best example I give to people when I'm trying to explain this concept to them is think of a blood pressure cuff. Now, if you didn't have a blood pressure cuff, as a physician, you'd have a heck of a time treating high blood pressure.
You sure would.
For one, you'd have a heck of a time diagnosing it.
Right.
It's not easy to diagnose high blood pressure. You know this.
Right.
You can't rely on symptoms. A person can feel great and have high blood pressure.
Right.
So you have to have a method to, one, diagnose it. But even more importantly, if you diagnose using your blood pressure cuff, that's, a person has high blood pressure, now you're going to give them a remedy for it. You're going to have them do something, take a medication, say. If you don't have a blood pressure cuff, how are you going to know if it's working?
Exactly. So it's just being a scientist.
Yeah. So
this is scientific medicine.
So if I want to improve somebody's oxidative metabolism, I better have a way of measuring it. And then I'm going to measure it first. And if it needs help, I'll give it some help. But then I have to measure it a second time to make sure that the help I'm giving it is working for them, because none of us are wired the same.
Exactly.
If I got 4 people with low oxidative metabolism and I give them all the same therapy, maybe 25, maybe a quarter of them, maybe one of them will actually see an improvement with that. The other 3 won't.
Wow, what a fantastic
So I have to sort
test.
it all out.
Now, you do a lot of other things. You would do what I would call real integrative medicine, meaning you're looking for all kinds of strategies that can help your patients, and you're not really terribly concerned about what those strategies are as long as they seem safe and have some possibility. You'll study them and then maybe give it a try.
Oh, yeah.
What kinds of other things are you doing that round out your practice?
Well, we do a lot of lab tests. And
talk about the biochemistry of nutrition.
Probably, one of the most important things we do, probably, maybe even the most important thing I do in my practice, is take a history. I mean, take a good history.
What does that mean?
Not a quickie little history.
What does that mean?
Okay, for me, it means I want to know the chronological order in which everything has occurred in their life.
What happened?
Okay, so if they tell me I have a complaint of headaches, I want to know, when did those headaches start? If they say they started 10 years ago, I want to know, can you remember when they started?
Right.
Did you wake up with them, or was it come over insidiously over a 6 to 12 month period? Can you remember any details about it? And so we kind of get that down. Then I say, has the nature of the headache changed over the years? But specifically, I want to know what happened in your life in the 6 to 12 months leading up to the onset of that symptom.
So why?
Because that's going to help me have a pretty good idea of what throws them into imbalance. You know, if they told me, oh, it was a very stressful time in my life, I can focus more in on that angle.
Right.
If they told me, you know, that they moved into a different house, then I'm going to start thinking maybe there's something in that house.
Okay.
Or if they got a different job.
Or maybe there's an accident.
Yeah, there's an accident and they hurt themselves. Yeah, exactly. Or maybe, how about this? How about they started on a medication 6 to 12 months? A lot of my patients are sick from the medications that we as physicians give them.
Right.
And it's often overlooked. I can't tell you how many times I've had a patient say, I have such and such a symptom. I've been into hospital after hospital. They've given me 5 or 6 drugs for the symptom, and it turns out that that symptom was due to a drug that was started on them, and nobody ever thought to ask them, oh, by the way, what happened 6 months before you got the symptom? Oh, I started that new drug, but you don't think that had anything to do with it, do you?
Right. Yeah, it's remarkable. See, I would agree with you. I think the patient's story is something that really needs to be listened to, and it takes time. It takes a lot of time. It'll take me an hour usually just to do that part, and sometimes many hours, because people come in with different situations. And often what I'll do is ask them to write an autobiography of their physical, emotional, and spiritual life and email it to me, and then I'll look that over and hope they'll put it in 6 or 8 or 10 pages. The information that comes from that sometimes makes it unnecessary to do all the complicated workups that we do, because they don't expose the psychospiritual basis for a lot of what's happened. And I know you, being the holistic physician that you are, pay a lot of attention to that. So when you answered that question about what do you do with the patient that's important, and said, I take a history, I listen to their story, I really identify with that. Such a critical thing. Because you do so many high-tech things, it's easy to forget that. And in a half-hour show, to try and go over all your high-tech stuff would be impossible, because there's just too much. But I'd like people to get some kind of idea of some of the other things that you do, just with a brief amount of attention to each one, if there, you know, time being as it is, to show the kinds of things that make you really practice as a physician. Well, okay. So one of the things we look at is toxins, and we look at heavy metals. So most of my people, if there's any chance that the reason for their problem could be due to lead or cadmium or mercury toxicity, they're going to get an evaluation for that. Okay, so what do you do? Oh, well, I'll do hair analysis, or I'll do blood analysis, or I'll do what they call provocative urine analysis. And then, so that's one thing that we'll do. The other thing that we can do is we can check vitamin and mineral levels. We can run tests to see how their immune system is functioning. I have a whole theory around how the immune system has to work. So there are ways to test how well that immune system is staying in balance and self-correcting itself. Exactly. People with autoimmune diseases especially, very critical stuff. Those are all important things. We look at hormones. I think, you know, for anybody over the age of 35 or 40, hormones can definitely be in the picture, so we need to start taking a look at them. So we look at them, evaluate them. And I'm a big believer in clinical trials. What does that mean? I'm a very big believer in clinical trials. That means you learn about your patient by doing something to him and seeing how he reacts. That's an outcome experiment that we do every time we put a pill in somebody's mouth or we give them any kind of therapy we do, because everybody is different. So it's always an experiment. I like looking at that. Like I had a lady once that I won't forget, because it was just a very dramatic story. You don't forget the dramatic stories. But this is a young woman. She's 27 years old. Her thyroid blood tests were totally normal. Okay? The only thing she was complaining about, this 27-year-old woman, was chronic migraine headaches. By taking her history and by just sort of trying to figure things out, even though her thyroid tests were normal, I thought, you know, maybe she needs some thyroid. So I initiated a clinical trial. Basically, I gave her thyroid. Tests are normal. No overt signs, clinical signs of hypothyroidism, but it seemed to me that the whole story that was going on with her maybe pointed in that direction, so there's a possibility. So that's a feel you have with experience. So I gave her some thyroid, her headaches went away and been gone. I still talk to her. This was 27 years ago. Her headaches were gone within 1 month and never returned. Wow. Now, that's a clinical trial. It tells me that her migraine headaches
were caused by low thyroid hormones. And so I do a lot of that kind of thing. If I think that, you know, such and such a problem is going on, I'm going to go ahead and give things, maybe in a sequential pattern, to see how the patient responds to it.
Well, when you think out of the box a little, different than what you were taught in your internship and residency in medical school, and start questioning some of the things that we do in medicine, a lot of red flags go up. And when you're looking at thyroid tests in particular, I mean, the way that they put these tests together is they say that if you're 2 standard deviations from the mean, that's just a statistical way of saying, if you fall in a certain range, you're probably, with 95% correlation, going to be okay. But there's 5% that don't. And those are the ones that slip through the cracks. These are the patients that you and I see in our practice, and these are the ones where you have to go outside the boundaries of what conventional medicine might dictate according to its strict rules. And then, by using your ingenuity there and applying your experience, you come up with ideas like this. And it also fits back with the test, that bioenergy test that you designed, which is clearly showing whether or not this is the case, aside from what the laboratory tests show. Because the laboratory tests aren't perfect. They never are.
There's no test that's perfect. My test isn't perfect.
No, of course not.
The blood pressure tests aren't perfect. You know that.
Right.
So there's studies about how imperfect taking a blood pressure measurement is. So.
Right. So when you're talking about being a real doctor, okay, a real healer, the story, listening to the person, using your experience, being intuitive, not just scientific, because it's really one spectrum of intuition and science. I think science and spirituality are in the same spectrum, and they're just extremes of it that you can look at it if you want to. And I know how spiritual you are too, and I'll bet, I'll ask you this, but isn't a lot of what you do in medicine geared towards your intuition and your spiritual nature?
Turn myself
on. Okay.
Well, I was going to say, before I get into that, I wanted to say it's trends. I look for trends on things.
Okay.
So that if I'm looking, again, let's come back to the blood pressure analogy, since everybody's familiar with that. I'm not so much interested in what the absolute value of that blood pressure is, although I am, but I'm more interested in what's the trend over time.
Right.
And I think that one of the things physicians really can do, that helps a ton, is to be like real, true, honest-to-God family doctors and follow their people over time.
Oh, yes.
And take measurements over time and make flow charts and graph and look at things like PSAs or whatever you want to look. Look at what the trend is over time. And then look at what the trend, how the trend is affected by your therapies. And based upon that, you can get a really good insight into what that individual person needs.
Yeah, well, see, you sound like a scientist. And unfortunately, we're out of time. But you sound like a real scientist who looks at the data, takes a special interest in your patient, and then does something based on that information that requires some kind of logic. So what we have here is a story of somebody, Dr. Frank Shallenberger, who's a whole physician. He treats body, mind, emotion, and spirit as one thing, not four. And he uses his scientific training in ways that are out of the textbook. He doesn't necessarily use what's there. He reads a textbook, and then he looks at it and says, this is interesting. What if this is the case too? And then he takes it to another level. And what you wind up with is a whole different brand of medicine that makes you a pioneer in healthcare. Thank you, Frank, so much for being part of this show.
Thanks, Len. Enjoyed it very much.